everyone, welcome to the programme. I'm Rebecca McLaughlin-Easton, and this week we're focused on health matters, in particular the rise of lifestyle diseases and what can be done to prevent them.
So everyone really should work together as one body, serving the humankind.
A little bit later on, we'll examine childhood obesity in the UAE and meet an inspiring student who drastically changed her weight and her life. But first, the World Health Organization's regional director for the Eastern Mediterranean was recently in the UAE, and we discussed the health emergencies facing many Middle Eastern countries. When it comes to flagging up what the health priorities of governments in the Levant countries, including Lebanon, Syria, Palestine, Egypt and Jordan, should be, Dr. Ahmed Al Mandhari is the WHO's key figure. He says the region faces major challenges caused by natural and man-made crises, including socio-political and economic instability. He's calling for united action to strengthen health systems in these countries and to, in turn, immunize and cure their people, and his plan is called Vision 2023. Diabetes and obesity, dubbed as diabesity, are conditions high on Dr. Al Mandhari's radar. And in the Middle East and North Africa, diabetes cases are expected to rise by 110% to 82 million by 2045, according to a report by Colliers International. 8 countries, including Kuwait, the UAE, Saudi Arabia and Lebanon, have the highest global ratio of obesity amongst adults, with 27 to 40% of the population affected. When it comes to the economic burden for the region, it's expected to jump by 67% to $35.5 billion in the next 26 years. When he was recently in Abu Dhabi, Dr. Al Mandhari discussed with Inspired the medical challenges facing the Middle East and his master plan for helping the Levant region. Dr. Al Mandhari, a very warm welcome to Inspire Middle East.
Thank you very much, Rebecca. My pleasure.
You've launched a paper called Vision 2023, which aims to really improve the health of populations around the world. It has a tagline of no one being left behind. What exactly does that mean?
I'll be working strongly and in collaboration with member states and other United Nations agencies to serve citizens of the region. Globally, we are facing a lot of challenges. Challenges that are resulting into sometimes emergencies and disasters, either man-made or natural. So everyone really should work together as one body, serving the humankind.
Talking specifically about the Levant region, which falls under your remit, from Palestine to Iraq to Libya and Lebanon, what are the most pressing health emergencies in some of these countries, especially on the preventable disease front?
One of the top listed challenges is communicable diseases, resulting from microbes that have been history in the past, but now coming back again. Polio is one of the diseases that is really worrying us, that is keeping us alert all the time by strengthening the immunization program in every country. In our region here, there are countries having outbreaks of measles, so that's why we are working very hard to spread, and carry out immunization campaigns that protect children from measles.
Broadening the discussion to the wider Middle East and North Africa region, we're facing something of a twinned epidemic, that of diabetes and obesity. Are the governments doing enough to really treat the cause and not just the symptoms?
To be honest, there is more to be done. And one of the key success factors for such fight against these type of diseases is raising the awareness of citizens, awareness of the public in terms of healthy lifestyles, like, for example, physical activity, improving the physical activity, eating or following good food habits, and avoiding some of the risk factors, like, for example, using salt in the food, that much salt, avoiding sugars.
Speaking of those sugars, of those foods containing salts, are you in favour of a sin tax? Is that the best way to get people to reduce their intake of these products?
Yeah, definitely yes. Because to be honest, looking at the literature and studies done so far in this area, it has been shown that these are the quick wins. If countries would like to really improve the status of their citizen, because of these diseases. But also it is adding to the budget of these healthcare systems by making use and earmarking, these sort of revenues resulting from the taxes that are obtained by countries.
Is there enough awareness of the mental complications that come with these so-called lifestyle diseases, even diabesity, as it's being coupled together as a term, especially with children? Are we dealing with the psychological symptoms of these conditions as much as the physical?
It is well-known fact that patients diagnosed to have diabetes or hypertension, or those undergoing the complication of these two diseases, they'll go into a sort of mental, emotional and psychological disturbance, like a denial, for example. They go into that sort of mental stress, especially children. So this is an area that it needs to be taken care by member states.
I want to ask you, if I may, about Yemen. You've been on the ground, you've seen the situation there, and the latest UN study says that there's more than 360,000 children who are severely malnourished, who are fighting for their lives daily. Mm-hmm. What's your assessment of the situation on the ground? What does the future hold for these children?
I've been there 3 months back, almost 3 months back, and I've seen, situations there. I've seen children. I visited hospitals. I visited, nutritional rehabilitation or therapeutic centers. The work done in these centers is really a miracle to me. I have seen children coming with malnutrition at different levels, some of them severe, acute, chronic, mild and moderate. The challenges are huge not only in Yemen, it is around the globe and especially in our region. But at the same time, I must say, based on my visits to these countries, in every challenge, there are tens or hundreds of opportunities. We just need to be very quick, very flexible, very dynamic in exploring these opportunities and making use of these opportunities.
Dr. Al Mandhari, it's been fascinating speaking to you. Thank you for your time.
Thank you, Rebecca. My pleasure.
Thank you. Conditions like diabetes and obesity place a huge burden on the healthcare systems and budgets of governments around the world. In a bid to tackle the rising problem in the UAE, schools and clinics are making it their business to teach pupils how to eat right for life.
When I was younger...
This is gonna fall.
18-year-old Nuran Fuad is on the move to change her life. At 167 centimeters tall, this high school student used to weigh about 85 kilograms, and in 2 months, she's lost more than 10. She says what she gained is truly rewarding.
I feel a lot more active, because before I used to have a lot of goals and I never used to do them because I was too lazy and I was always sitting down. I never used to move. I didn't want to show my body to people.
Stepping out of her comfort zone, Nuran went weekly to Dubai's Denovu clinic for a holistic approach to weight loss, including an overhaul of her fitness, diet, and social habits. According to the facility, weight gain is not only genetic, but due to behavior. What is widespread with some in the Gulf, however, is a sedentary lifestyle and a fast food culture.
No, the common trend is the family and peer pressure. They feel that it's very disrespectful to not eat when they're invited. They don't know how to say no.
Standing up to those influences has helped Nuran get closer to her goal. She plans to go to university later this year and is enjoying her newfound self-confidence in the meantime.
I have 10 more kilos to go, that's my goal, and I think the fact that I'm starting a new life with the new body, with the new form, with the new mindset that I have, it's going to really impact me in the future that I'm going to have.
The number of obese children aged 5 to 19 years old has increased tenfold worldwide in the past 4 decades, from 11 million in 1975 to 124 million in 2016, according to a study by Imperial College London and the World Health Organization. Children in the MENA region have one of the top 3 fastest growing obesity rates, with more than 20% of the youngsters classified as obese. Students spend up to 8 hours a day at school in the UAE, making lunchtime one of the most important meals of the day. The target of some is to provide healthier food choices with the goal of instilling healthier food habits. Instead of packed meals and ready-made sandwiches, children at the Jumeirah Baccalaureate School in Dubai have an open buffet of nutritious food. from vegetarian options with sugar-free ketchup and mayonnaise, encouraging students to develop a taste for wholesome habits.
My favorite food is salad, so we can get healthy and we can get stronger.
I met with the CEO of Slices, a food company feeding 10,000 UAE students a day. His plan is to use technology to track and inform parents what each pupil is eating.
So right now we are building a dashboard that shows parents and students what's the amount of fiber, protein, carbs, all of the macronutrients that has been consumed by students, and comparing that to global school food standard.
The application is expected to launch this year in an effort to have students not only bring back homework from school, but also healthier eating habits too.
Well, that is a wrap of our show. We hope you enjoyed it, and do catch all of our episodes online at euronews.com. Before I say goodbye, here are some healthy food posts that caught our attention on social media this week. Nutrition and fitness blogger Natalie, who used to weigh 150 kilograms, shared this before and after photo of her weight loss journey. Lebanese fitness instructor Zahi posted this time-lapse of his high-octane spinning class, saying healthy habits must be for life. And trainer Rawan from Saudi shared this snap with her eldest daughter whilst pregnant with her second child, commenting that setting a good sporting example for children would keep them healthy.